verify that the person's looking at me. Are they alert? I've got a radial pulse, and I'm going to grab a C-spine here. Sir, I'm just encouraging you to look forward. I'm going to ask you some questions. And does your neck or back hurt? No. Okay, fine. I'm going to clear C-spine at this point and say there's no perception of pain there. And based on whatever the call mechanism of injury that was there, if there's no consideration for C-spine, then I'm going to say it's clear. Okay? I have a radial pulse, and at this point, I'm going to say you're not sick and I can handle with the resources I currently have. Okay? So going through my quick rapid, I'm just feeling up. I don't see any blood. Reaching as far in as I can. I don't see any blood. Don't see any blood when I get down here to the waist. I'm going to lift up the shirt and check. I don't see anything. Quick breath. Okay, no pain there. Pushing in on the sides, no pain there. Quick palp on the belly, soft, non-tender. A quick down and in on the there. Looking for blood. Looking for blood. Don't see any blood. Don't see any blood. Didn't see any blood on the arms, but I'm going to do a quick check here. And now my blood sweep is done. My rapid is done, and I have not identified any life threats. Make sense? So it's super quick, down and dirty. Make sure you're looking. Okay? Okay, so now I would do vitals. Blood pressure cuff on. For him, I'm probably going to try to grab the XL cuff because I know, based on experience, that he's got big arms, and likely if a normal cuff goes on, it's probably going to be right at that edge. And if it's going to be right at the edge, you might as well just go to the next size and get the right size on, because a small size cuff on a big arm can show a higher pressure than it is. So cuff is on. I'm going to grab a radial, pump up. I'm going to be taking a palpated blood pressure as I let the air down. Now I have that number. I'll deflate the cuff all the way, continue to hold the pulse while I count a pulse rate. And as soon as I'm done doing a pulse rate, I'm going to watch him breathe. I'm not going to tell him I'm counting his respiratory rate. I'm just going to count it. And then I have all those numbers in my head. Now, based on everything I have seen and the vitals, are they still BLS or are they ALS? And make the appropriate changes to your decision. So now we're going to go through the secondary. Okay? So it's just a more thorough check of everything we've already seen. So coming back here to the neck, if I have already placed a collar, obviously I wouldn't be able to do this, but I'm going to get as far down on the neck as I can. So I'm back kind of top scapula, maybe mid scapula, way back here. See even if I feel anything different, all the way around to the top of the head, forehead, okay, maxillary, jaw. Can you open your mouth? You run your tongue inside your mouth. Feel any broken teeth? No. Okay. Check all the holes in the face. So, sir, I'm going to check your eyes. I just want you to look right here at my nose, okay? So I'm going to take the light and I'm going to shine it on this side, looking for dilation. But then I'm also going to do same side, but I'm looking at the right eye, okay? So your eyes, no matter where the light goes, they should be equal. So I'm going to check both like that. So quick check, and then quick check this way. Eyes are equal bilaterally. Coming down here to the chest now, looking at the neck, no tracheal deviation, no jugular vein distension, clavicles, shoulders. Again, I've already bared the chest on my rapid, so I know what I'm looking at. I can do a quick palp here, deep breath. You're looking for change in palpation. Here, when I wrap the rib cage, I'm really trying to wrap my hands around the rib cage, so nice big breath. I'm looking for paradoxical movement, broken ribs, things like that. Okay? I'm not gonna pass here without doing lung sounds on a secondary. So 4 spots just under the clavicle. Normal breath for me. Okay, and then when I go to the sides, I'm looking for this soft spot, right, just down from the nipple line. Big breath for me. Okay, and one more. Okay, lungs are clear and equal bilaterally. Moving down to the abdomen. Okay, drawn an X right here. If they had pain in the abdomen, I would start away. Okay, just looking for soft, non-tender. Okay, sir, I'm gonna have to check your femoral pulses, okay? So I'm gonna have to undo your pants. So, when I'm checking femoral pulses, I'm gonna find his hip bones, which are right there, starting with my heel of my hand on the very top of the hip bone, and I'm just gonna move so that my fingers are running down the crease, and then feel how hard I'm pressing. That's how hard you have to press. So I've got both of your femorals nice and equal and strong, okay? Pubis, my middle finger over the belly button, and nice and easy with the heel of my hand, right? Yeah. So I'm not doing CPR on his pubic bone, just feeling that it's intact. That's part of your pelvis check. Okay, and another in, and when I go down, you see how I just apply light pressure, and then I can apply some firmer pressure. Now that's totally stable. Any change in that's why you gotta start really easy, okay? So pelvis is done. Come back down here to the extremities. I'm just giving opposite movement. I don't need to go this way. If there was any movement, I'd already feel it on this one. I try to keep my hand low on the inside leg, right? Just dignity-wise, staying away from that area. I don't need to be there. Come down here to the feet. If I was working in a team environment, I would have my utility player or my skills person already doing this for me. That's going to be an interesting part of that video.
Played it off so good.
I feel like now stop sitting.
Okay. So boots off. Okay. So finding pulses down on the legs. You could sit up for a second if you want to see this part of it. So the square part of the ankle right here is where the vasculature comes out of. So start your top finger there. I use basically those 3 fingers. Starting there, laying it on top of the foot, and then applying pressure until I feel the pulse. So, and then I take my fingers away because I'm going to mark where these are. In a true trauma scenario, I don't want to have to look for these again. I don't want Harborview to have to look for these again. If they're a major ALS patient, I want them to be able to get it soon, right? So you need to just continue to verify it. And you're probably going to check it on your secondary or whatever you're doing on the way to the hospital.
Is that sometimes why they mark people's hands and feet to mark like where they found the pulse at?
Yeah.
Okay.
I'll just put an X right on it.
Right, yes, exactly.
Yep, you got it. If you couldn't find the top one, if you're just somebody that has a hard time, or you have smaller hands, sometimes this can be difficult, right? I see a lot of people try to do pulse checks like this. Like, I know I'm good. I'm very good at anatomy, and I'm gonna find it right away. The tips of your fingers aren't gonna find it as quickly as the pads of your fingers. But if you can't find this top one within a few seconds, you can turn your hands to the inside, drop down, dive in right behind the ankle bones, and you'll find them there. Okay, if that doesn't work, you can skin or nail bed checks, and 2 seconds or less is good cap refill. Okay, so when you're down here doing that CMS check and I find your pulses, sir, can you feel me touching your feet?
Yes.
Does it feel the same on both sides?
Yes.
That's it. No tickle fingers,
Okay.
not necessary. And then I would come back up to your arms. I would do the same thing on your arms. Yeah, it's fine. You can sit down. do the same thing on your arms with just a quick palp this way. If there's no injuries to the extremities, then you can bring both arms back up here to the chest. That gives me the opportunity to do bilateral pulse checks up here. Sir, can you feel me touching your hands?
Yes,
Did this feel the same on both sides?
yes.
All right, great. So my secondary is done. I do a full second set of vitals with an auscultated blood pressure now, cuffs still on. And that's it. Okay, good, thank you.